right? Engaging in the use of alcohol or drugs. So usually, basically, maybe summing it up, you are facilitating your family members' use of their substance. It is not something that is stopping or hindering or putting a boundary. It is something that is allowing for the behavior to happen, the actual use of the drugs, either by giving them the money, by helping them drive to the dealer, helping them get 60/60 money, all of that. Avoiding natural consequences is one that we've discussed in the previous slides. Not setting boundaries or lack of follow through, right? Which we also kind of touched on when we looked at, have we discussed this? Is this a problem that is reoccurring? If it happens once, we can understand, we can educate, we can be fair and say, okay, this month we'll help you with the rent, but next month, this is how your budget needs to look. If that doesn't happen, then we need to set a boundary, So not setting boundaries that are clear and not following up and saying, no, I promise you, if you do it again, we're going to put a boundary, and actually not going through with that. Ignoring your own personal needs. This is so pertinent for parents and partners, actually, all family members, is I know it is not in my budget to give you this money. I know that this is the 6th rehab and we've helped you and nothing is happening. So, and we are tired and exhausted and we're going through our own things, but we put everything aside so that we can help you, right? So ignoring ourselves, that self-neglect, that feeling of, I actually don't feel like I have a life. I'm always just looking at the phone, wondering where you are, calling the cops for you, sending you money so that, where is my life? Hiding the addiction from other family members, from the police, from the counselors. This is shielding their behavior and saying, we're not going to tell your counselor everything. I don't want to get him in trouble, when we hear ourselves saying words like that. And then pacifying the addiction. So I kind of, maybe if Roxanne can jump in regarding this one, right? Because the pacify is to make something smaller or to minimize. What do you think in terms of this, Roxanne?
So I think the pacifying the addiction also ties quite nicely into the ignoring the addiction to a certain extent. So I do know we're also going to discuss denial a little bit later, but denial is a defense mechanism and it's there to protect us, essentially. But so it kind of protects us from the reality or the truth. It tries to shield us from that hurt and that pain. So us as loved ones would like more than anything to believe that our loved one doesn't have a problem or that their problem is not as severe. So we try and ignore the problem, or we try and make excuses. We tend to blame. So we might say, and I used these examples last week as well, we might say that it's the relationship they're currently in. It's such an unhealthy relationship. It's since they've been in a relationship with Bob or with Sally, or they're going through a really tough time at work currently. There's so much stress at work. So we kind of try and pacify it. We try and make it okay. It's not as bad. Yeah, so the way that I like to define justification is that it's a seemingly plausible excuse. So the excuse that we use, it to a certain extent, it makes sense, but the reality is that it doesn't make it okay. And I think that's what enabling is as well. We just try and kind of soften that blow a little bit. And we do that in various ways. Again, so when there's a blow up in the house, if it is perhaps your child that's the addict, you're like, don't worry, I'll speak to your dad. Just go get some rest. Or maybe phoning their boss when they have a hangover and telling them they're really sick, sorry, they can't come into work. So again, we're protecting them, trying to make it look like it's not that bad, whether it's to ourselves or whether it's to people on the outside. That's the way that I perceive that pacify.
100% agree. Do we think because I think a lot of families think even being really, really honest about where their family members have been, the types of behaviors they've kind of participated in, how severe their addiction is, because pacifying is such a big thing. And that's why I wanted just to open the floor and say, how does that look? Because it sounds so benign, but it's actually so entrenched in keeping our family members sick, where, even in therapy sessions, even in conjoints, we're not able to, divulge everything. You find clients leaving the therapy room and saying, yo, I thought they were actually going to say more stuff. I'm glad that they didn't. That type of feeling of them feeling like I got away with it. And that's what pacifying really feels like to me, is when we look at the grand scale of our family members' disease, we pick which things we want to present to the world. Even something as simple as, no, they have a mental issue, they have anxiety, rather than saying, no, they use a substance in unhealthy ways. Another big one is the alcoholic addict conversation of, oh, no, at least they're not on all of these other drugs. It's just alcohol, so I can give you the $100 so you can get the alcohol. That's fine. If it was hardcore drugs, then I would have a problem. So that type of, it's not as bad. It's soft, and softening the addiction can be such a simple thing, but that has such dire consequences or implications. Yeah.
Yeah, I think what you were talking about now as well, like, well, at least they're not using this, or at least they're not doing that, or, at least they're still there for their children, but
Mm,
we try and compare. And
mm,
again, we get into denial a little bit later, but I think that's what we teach to the patients, is that comparing is one of the behaviors that preserves denial. So it keeps the denial
mm.
in place. As long as we're looking around, there'll always be people who have situations or circumstances that are bad, but that doesn't mean that my loved one's situation isn't bad, and that doesn't deserve some sort of
Mm.
intervention.
Enabling comes from a sense of anxiety, which is essentially fear, right? There are so many fears that we have: the fear of my family member enduring these consequences, the fear of just losing the relationship or being the bad guy, right? And that's why, in family conjoints, we will always uh encourage you and empower you to say that you have done nothing. You are highlighting what somebody else has done, and that's why it's simply put to be enabling, because you are struggling to hold them accountable for what they've done. It is easier to say, no, I'm going to look at the positive, even though I know everything that you've done. It's safer for me to say no things that they've done. And I think in Roxanne's slides last week, she put it beautifully by saying we want to be our loved one's favorite. We want to be the one that they come to. We want to hold their trust and loyalty, lose that platform of loyalty. So I 100% I hear you, Tasneem, but it is unhealthy for your family member, because he knows what he's done. And if he leaves the counseling room knowing that some of the things that you should bring up have not been brought up, it makes it easy for him to evade, right? I don't know if Roxanne has anything around that.
Yeah, I agree. I think it's so difficult. We we want to be cognizant of the fact that this is a relationship that we want to work on, but I think part of that relationship going forward needs to be based on honesty. And we need to be able to speak about the things that have hurt us and that have bothered us in the past. But at the same time, we also need to give our loved ones the opportunity to work through those things. So
Yeah.
um, we can't fix, or we can't change the things that we don't acknowledge. So I think it's important for them to become aware of it. And in therapy we see it all the time. We speak about it as being them being in denial about something, or having a blind spot. So
Mm,
sometimes they just really weren't able to see the impact that something had on someone until they hear it from your perspective. So sometimes it's really, really important to do that,
mm,
not with the motivation to hurt them or to damage the relationship, but to say, look, these are things that have been a problem in the past, and these are the things that we need to work on, and we need to change.
Yeah.
And I know it's difficult. I know it's so, so
It
difficult.
is. It really is. But I think just focusing on the intention, if the intention is to shield our loved ones from their consequences, then we need to look at it. The intention should be to help them grow, and their behavior is theirs to own and to really take accountability of. But yeah, beautiful, beautiful input, Tasneem and Roxanne. The final point is lying on behalf of our addicted partner or family member, right? This is simply put, I'm lying to my landlord, I'm lying to their manager, I'm lying to the school, I'm making up a story that is not the truth so that they don't look bad or the truth doesn't come out, right? Simply put. If you could go to the next one.
Sorry, I just want to add to that. So sometimes we we lie to the community at large. So we mentioned the example of bosses or etc. But sometimes we even lie to those that are closest to us,
Mm,
to trying to protect them and shield them. So again, if it's perhaps a child, you
mm,
know, we sometimes lie to our partner because we're so tired of the conflict and the chaos, and in an attempt to try and avoid that and also
mm,
protect ourselves, we lie, and eventually it feeds into that chaos, of that is addiction. So
mm,
yeah.
mm. So, in terms of enabling, right, how can we stop? The biggest thing is honesty, which Roxanne just touched on. Being honest about how we feel, how our family members' behavior makes us feel, how what they've done, their actions, their behaviors, their mistakes, quote unquote, basically their unhealthy behaviors and patterns. Being honest and confronting and truthful about this is what you're doing and this is how it makes me feel. I'm not going to do that. And then after we are honest, then we can start to set boundaries. That's why honesty is the first thing, and the first important thing is just saying it as it is. Because if I said it how it is, I've communicated to you how I feel because of your behavior, and then I'm now allowing you to introspect and say, okay, I see that, I did do that, I acknowledge, and then I can work on it. And then if I don't work on it as a family member, then you can set a boundary.
The employers can't discriminate against you if you went for
Mm.
treatment.
Yeah.
Oh,
And they
okay.
can't discriminate for up to a year, 18 months. So they're quite protective around psychiatry here. However, it's the work knows. So seldom the work doesn't know. If you use, somebody at work knows, your boss sees it, your productivity goes down.
Yeah.
But it isn't for you to disclose for your family member, but people know.
Yeah.
Thank you, Dr. Tia. Yeah, and I think so. The example that we were using was also like not phoning and making excuses as to why they're not at work. So while they have a hangover and they're sleeping it off, you worried about them not going to work. You worried about them possibly losing their job. They're sleeping it off. And that's when we try and jump in and we try and intervene and, oh, sorry, no, he's sick, he's not feeling well. That to me is enabling. The
Yeah.
opposite of that is not necessarily phoning the employer and letting them know what's going on, not at all. But just saying, you know what, you made this mess, you sort it out. I'm not stepping in, I'm not making excuses, I'm not rescuing, I'm stepping away from this chaos, I'm not getting involved. So the first one there about setting clear boundaries, I think that needs to be the boundary. And when it comes to enabling, we often speak about detaching with love. So it's not detaching from the person that you love and not loving them anymore. But you're saying, because I love you, I'm stepping away from this chaos. I'm not getting involved in this chaos. I love you and I'm there for you, but not this chaos. I'm not going to be part of it, and I'm not going to allow the chaos to continue. I hope that helps, Christoph, but thank you very much for that input.
Very, very pertinent question, right? And I think even just the essence of how involved we are in our family members' lives, we need to be able to understand where we start and where we end. That's also another trend of enabling, or another indication of a lack of boundaries in the family, is when I'm in your school and your work and your finances and your home, because I believe that you can't do it on your own. But when we start to set boundaries, and when we stop enabling, we start to say, as this person who is this many years old, you should be able to manage this and this and this and this. If you can't manage it, I can assist you to a point. Assisting is I give you guidelines and then I step away to live my life, but where we are now involved and we try to block and cover and, hold them up and present an image that doesn't really exist, that's where we start to see issues emerge. So simply put, understand where you start and end, where your family member needs to own up and where their consequences have to happen for them. And consequences are such a difficult word to sometimes sit with, and it's like I can't just do nothing, but it's a beautiful way to learn that if I do one, I will get two. And for me not to get two anymore, I need to stop one. So even in treatment, we teach them very simply about, if you don't do something, we have a contract. You will lose a specific thing, simple like a phone call. And it's so small, but it's so motivating to say, so that I don't lose my phone call, I will do this. And that's just life. We need to always kind of work with the world to get what we want and what we need. And that's the basic message from it, from consequences or setting boundaries as a parent, is you're teaching your child how to be proactive in their own life to prevent their own consequences, right? The second one is confronting, which can also be quite helpful in terms of, this is what you did, I'm not doing it anymore. It can also be in the moment, when we feel, because why we need to sometimes use the word confront is we will get manipulated, right? Mom, if you don't help me, I'm going to lose my rent. I'm going to lose my job. Please help me. If you don't help me, it means you don't love me. I can't believe you will let this happen to me. So that's why we need to confront and say, oh, okay, right now, what you're doing, you're trying to manipulate me, okay? And I'm not going to enable you. Mom, if I don't get tuck shop, I'll be sitting alone and everybody will be eating their snacks and I'm not gonna be eating snacks. When we start to hear that little voice that says, oh, my baby, that's when we have to learn to confront and say, okay, my baby, I do love you. My partner, I do love you. But right now, I feel that you are manipulating me or you are blackmailing me, and I can't enable you. Simply putting it like that is also quite clear, because we do teach them about manipulation and enabling, and they know exactly what they're doing to elicit those emotions. Roxanne, anything from your side?
Yeah, so I think when we speak about confronting, we often go, oh, no, I don't want to do that, because we're tired of the confrontation, right? We're tired of the chaos. So, the way that I always try and explain it is to say we're challenging the behavior, we're not challenging the person. So it's not having a go at Billy or Bob, but it's saying this manipulation is not acceptable and I'm not going to stand for it. Or this dishonesty. So yeah, not having a go at the person, not but the behavior.
Behavior. It teaches so much of, oh, you see me. We usually say addiction works in the shadows. And if it's in the shadows and no one says it or confronts it, it will persist perpetually. It will happen forever. So we need to say, this is what I'm seeing and feeling, and I'm not allowing it. Simply putting it like that. And then stage an intervention. This is when when we're at a point where it gets quite hectic, where we need to really intervene. We need to confront. In terms of this, it can be behaviors that we see while our family members are in treatment, behaviors that we see even when they are in recovery, right? Enabling can look like enabling the drug use, but it can be enabling certain other behaviors, like enabling the manipulation, enabling the victim, enabling the denial. So I always encourage family members that if you are sitting with your family member on a phone call while they are with us, and you are hearing them talking about everything, and I never really had that big of a problem, Mom. I just had to sit and get a detox, and after this I'll be fine. When we're hearing the denial, when we're hearing the manipulation, and I know you're not going to send me to the farm because you love me, you want me to come home, and I know that when we start to hear these things where we're being pulled into a specific direction, we need to always let other people be involved. So the intervention can be the grand intervention where we're all sitting and we're telling our family member, but the intervention can be of the small things. involving other people. Tell your mom, tell your dad what you said to me, or tell your counselor what you said to me, about not going to the farm. So bringing the behavior to the light and saying, I'm seeing what you're doing. Like I was saying, addiction works so beautifully in the shadows where it's unseen, because then it kind of thrives. But once people see it and we call it, Roxanne, anything from your side around this?
No, I'm good.
So the final one is quite simple, right? Learning how to say no, which is it sounds so simple, but it is so difficult. No to everything they want, no to things that are unhealthy. Sometimes learning how to say no to ourselves and our feelings. If I'm feeling that anxiety in my gut that makes me want to say yes to my family member, if I'm feeling like, oh, but if I don't say yes, I'm going to be such a bad mom, or what are my friends going to think, and what is their career going to look like? So our own feelings of inadequacy and shame and guilt sometimes, and just pity. Sometimes we need to be able to say no to our family members and a lot to ourselves, the urges that we have to save and rescue. Anything, Roxanne?
No, I don't think so. But I think this is the last slide of enabling, if I'm not mistaken, in Essentia. So I'd
Yeah.
like to maybe hear from the families that are on this evening, if there's any questions around enabling, any comments, anything that you'd perhaps like to share.
But I think so many of us on this platform can relate because it becomes such a norm.
Yeah.
He's at university, he's not working, he doesn't have an income, and we have to pay,
Yeah.
we have to go pick up, we have to drop off, we have to. And I think when we, as the enabler, the codependent, the family member, actually stop and say, I'm choosing to,
Mm. Mm.
it keeps a very clear, delineation. It also stops the resentment. I think it stops us getting frustrated with them. We have to understand. And I had this conversation with my own family member half an hour before group started. He's complaining about what happened in the past, and she did this and she did this, and why hasn't she learned? And I said, well, why haven't you learned? Because we have to learn that no, learn to say no. I know no as a complete sentence. But for us as enablers and codependents, our throat actually closes when we're going to say no to our loved one. Our head's thinking, what can I say? I haven't got money now. It's the wrong time of the month.
Yeah.
You didn't behave. Like, just no. No explanation. No, just no. And these are the things I think we've got to start practicing. Sometimes even in the mirror, say no to your dog. Say no to the beggars on the side of the road, because you're enabling them too if you're giving them money. So I actually like to say, I don't use the word enabling anymore. I call it disabling.
Yeah.
Because we're taking away the opportunity to grow. And I threw that question in about mental health earlier because I think it's quite hard for us to come to terms that a lot of our loved ones have mental health conditions. They've got comorbidities. And we make excuses for that. And that was the conversation I was having with my sibling. Is he said, yeah, but she's got bipolar. I said, yeah. And I've got brown hair and brown eyes. It's not. We also got to stop seeing it as affliction.
Yeah.
They have the disease. They're powerless over the disease, but they're responsible for their recovery. And if they take the medication, they go to meetings, they do their 5 pillars, and they don't drink and drug, they should be able to take responsibility.
I'm an able-bodied adult, and if I don't pay my fines, something is going to happen to me. And what is that thing? And why am I trying to protect my family member from that thing? They need to learn, But I do like the compromise of we will deduct, having conversations like that to say it doesn't just happen magically. Your problems don't just go away. They will be an actual physical thing that is taken away from you, and it goes to fix that thing, But the beautiful thing should be they should say, you can deduct from this and this and take it to the fines, because clearly this person knows how to drive a car, so they should know how to pay a fine as well, you know?
But I kind of want to add to that in a sense. So it's not like it's something that was done to him, right? It
Yeah,
was a consequence because of something that he did. So
100%.
that's why he got the fine. So, you know, we have a bit of a JFT that we use something about, you know, if I'm old enough and responsible enough to use drugs, then I'm old enough to take responsibility. So if I'm old enough to drive and to break the law and drive over the speed limit, then surely I need to do the responsible thing and take the consequences of that. There's a question in the chat room in Essentia that says, when setting boundaries, how strict should one be? If loved one drinks, does one send him back to rehab, or do you keep giving them opportunities again and again? That's from Mike and Cynthia.
Yeah. Do you want to go first?
Can I ask if the families can maybe answer? People who've
Yeah.
actually gone through this.
Mm-hmm.
Please put your hands up if anybody would like to answer that question. One of the tough love principles is that families' emotional and financial resources are limited. So sometimes rehab is for the families. It's to buy us some peace of mind. I'm not a big fan of pushing them to rehab if you've just invested time, money, medical aid. So there's other ways of dealing with it. It is about them taking responsibility. It's also about to see, are they going back to meetings? Are they speaking to their sponsor? How long have they been using? They might need rehab if they're physically addicted, have not been taking their meds, and need to be stabilized. But it doesn't always have to be a Changes, professional 5-star rehab. It can be anything that you can afford. I think we always give our loved ones great opportunities, give them choices. But does it have to be luxury? Maybe not. So that really depends on the family and your financial and emotional resources.
My feeling comes up that we often, patients would have one relapse. They would do well for a year and a half. They'll stop their NAC. Often they stop their NAC and that's it. And they'll have a blowout. And if you sit down, about 50% of them can come back without a full-blown rehab. But they need to sign a contract, and if they're using after a week of admitting it, then they might need to go in. But patients sit in my office and they had a blowout. And they said 2 weeks later, and they're like, I don't know why I did it. I'm going back to meetings. I restarted the medication that I stopped. So I see people that has a relapse. But if a relapse is severe and becomes dysfunctional, you have to send to rehab. So a once a day thing, 1 day or 2 days, I see it, especially over Christmas. And a lot of those patients, by 20 days later, they've been clean for 20 days, they're back to 90, etc. But if they don't go back, then they need to go in.
Thank you.
Yeah.
Okay.
I think my biggest thing is, sorry, Roxanne.
No. Please continue.
Okay. So I thought I interrupted you there. I wanted to say, in terms of rehab, sometimes the perception that we have of rehab as being punitive can also make us wonder, oh, is it bad if we send them back to rehab? Does it mean we don't believe in them? So understanding that, like Dr. and Cheryl said, that if it is severe enough where they really need to be contained in a facility 100%, but we do differentiate between a lapse, which is a single usage of the substance. The individual takes accountability immediately and they follow the right steps, and that's where we see the difference between, do you need to be rehabilitated, or is this a full relapse? Are we back to where we started or worse? So understanding the difference there of, he drank today and then He called us, he told us, he phoned his sponsor, he's going to a meeting right afterward. So understanding is, are those steps happening without the family needing to push them into it? Are they taking responsibility, or is it full blown? We can't find them, they've sold this, they've sold that. So that dynamic also needs to understand. But the guilt from us also to say, we didn't push them to the substance. If we need to rehabilitate them, like Cheryl said, for our peace of mind, then it needs to happen, and for their safety. The big thing is, will they be safe if we give them, like you're saying, Mike or Cynthia, another opportunity again, an opportunity to get better, or are they going to now go into the full-blown addiction now? So yeah.
In a sense, I'm just cognizant of the time. It's almost 5:02, and we haven't done denial. So
I think, yeah. In terms of denial, we literally only have the definition of what denial is. Do you think we should jump into that, or should we stay with just enabling and look into if family have more questions, if more
There's
inputs are
two
there?
questions we're gonna, I think sustained recovery, or what was the word you used, Mel?
Sustainable.
Well, basically a long-term recovery without a relapse. So somebody who keeps on staying clean and sober, keeps on trudging through, struggling through, battling with recovery, and deals with everything life throws at them without picking up a drink or a drug.
I see Lindy. Lindy also tried to help and answer that question, and I love the answer. So it's an ongoing process of maintaining progress and well-being after overcoming addiction. Consistent effort to prevent relapse. I like that.
Perfect. Yeah, that's quite brilliant. Yeah, we do a sustainable recovery with our clients before they leave. It is literally a plan to say, these are my triggers, this is what I will do. It's a practical tool that we give them, that they write down, and they look at what their life outside looks like and what they will do when they leave, and what they will do if they're struggling. How will they be measuring their success or their health, their well-being? It's such a beautiful tool, because it's so it's the individual looking at themselves, looking at their environment, looking at their friends, looking at potential problems, and then saying, okay, this problem, I will solve it like this issue, I will solve it like this. But it also is such a nice guideline to give to family, to say, when your family member leaves, really look through their sustainable recovery and look at what they've said in there, if they allow you, of course, because they can give you such good insights into which friends do you need to be on the lookout for, because there's a section where it says friends to be, that I must not be in contact with, which days am I going to be doing what. It's quite a very beautifully comprehensive way to prevent relapse, because that's literally the plan, is to just make sure we are preventing a relapse.
Yeah, and I'd just like
Anything
to
from your
add,
side, Roxanne?
yeah, I'd just like to add to what you said about the sustainable recovery plan. So I think it's important to have some of these conversations. So, these are the boundaries. And so, in other words, these are the expectations that we have for when you do leave treatment. This is what's okay, this is what's not okay. And to also discuss consequences. So what will the consequences be if they do relapse, or if they do pick up, or, if they leave their washing lying around the whole house and they don't make up their bed and they're not doing, chores and stuff around the house, what will the consequences of that be? I think it's important to have those conversations before the time. I think it makes it easier in that moment when those things do come up and do happen to say, look, we've discussed this before. You've done X, and therefore we need to do Y. Something that I like to also teach the patients is just, if we choose a certain behavior, we also choose the consequences. We need to know that, for all behavior, there's a consequence, whether it gets implemented by other people or whether it's the universe, whatever the case is, but there are consequences.
And I don't think we should ever make it seem like stopping enabling is easy. It's the hardest thing that we have to do, because we're programmed.
yeah, it's tough, you know, when we learn that our families or our loved one is in addiction, is using. It almost feels like a bit of betrayal, right? So it's very difficult. I'm glad you're here. I think this is a great place to start, just to educate yourself on addiction, on what that looks like. And a lot of the topics that we cover is also not just about your loved one that is in treatment, but also about looking after yourself, the self-care that's really, really important, what you need to know, things like boundaries. So right now, you're at the right place, and I'm sure there's a lot of people that can help and support as well.
If I may, Barley, I think you're in quite a terrifying position, because a lot of us come here and we're so grateful that we've been through all this chaos and somebody can relate. So I think you're walking in like a deer in the headlights. Please keep a journal. Don't try and do anything right now. You don't need to. Nothing you need to do. The treatment team will guide you, tell us what you know, write us letters, give us collateral. All you need to do is focus on you. Take care of yourself. Unfortunately, as most of the families will tell you here, it's a long journey, but we just have to take one day at a time. And that's the advice we can give you just for today. Do nothing, take care of you, journal, educate yourself. Lots of information online, but please keep coming back. What we see, because what Dr. Tia is talking about is stuff that we only see down the line. We see a change in behavior. And when we see the change in behavior, that's the time to intervene. So it's quite a good indicator. When the behavior becomes socially unacceptable. And I think as family members, we become so accustomed. I call it the frog in the hot pot. You know, if you take a frog and you put it into a boiling pot, it'll jump out. But if you take a frog and you slowly increase the heat over a couple of days, the frog will stay in and die. And we become so accustomed to unacceptable behavior that only when there's catastrophic crises, we intervene. So a good rule of thumb is when you see your child's behavior is not acceptable, that's the time to intervene. When they no longer can choose if they're going to use the substance or not, the substance will take hold of them, and it's a line.
Maybe I should put it this way, that the risk of getting schizophrenia is 360% higher if you smoke cannabis. That's huge, because schizophrenia is a disease that people don't get better from ever. So here's the other thing that is really scary, is that there's about 120 different cannabinoids. And you can smoke for 10 years and not hit the 4 bad ones, because there's 4 of the cannabinoids that is problematic. One makes you depressed, one gives you a demotivational syndrome that you don't even want to get up and do anything. And then there's a psychotic one that you might end up being sick for 6 months or longer, or even develop schizophrenia. So I can smoke for 10 years and not hit one of those 4. My first pull can be one of those 4. There's no prediction. It's not how strong the cannabis is, or if it's very low THC, it's nothing. If you hit one of those 4, your life is gone. You can't predict when. Do I smoke for 10 years? Fine. I haven't got it. But my first pull can be one.
Thank you, Dr. T. Can I please suggest, because we do need to wrap up, I'm going to chat to Dr. Tia to please help us do a presentation soon so that we can understand the gravity of the pharmacology of addiction and on the brain.